I'm 67 years old, married to my lovely wife Bobby. I have 3 children, 2 son-in-laws, and 2 grandchildren. My career was a businessman on Wall Street. Gave that up 8 years ago. Now I work locally and spend a lot more time relaxing in my house with my family.
The Virginia side. He lives in.
I'm an avid reader, love mysteries and suspense books. My name is Gary, and I have Parkinson's disease.
Parkinson's disease is a progressive disorder in which patients are losing dopamine neurons.
Dopamine is a neurotransmitter that helps with body movement.
And when dopamine goes too low, patients get the signs of Parkinson's disease.
Muscle stiffness, rigidity, loss of balance, to the point where a lot of patients have a lot of difficulty walking. And as the disease progresses, it eventually starts causing cognitive issues and can be associated with dementia, to the point where patients are bedridden and immobile.
Gary has an extremely sharp mind. That's his greatest characteristic, and I was terrified that that would impact his ability to think and express himself. He's only gotten sharper, more focused. He educated himself about every detail of Parkinson's disease.
It affects about 1% of individuals age 60 and above, and 2% of individuals age 80 and above. Parkinson's disease can also affect young individuals. Michael J. Fox was diagnosed when he was 30. That brought a lot of awareness to the fact that young people can get it too.
No one knows the exact cause of Parkinson's disease, but most causes of Parkinson's disease is idiopathic.
There are some environmental risk factors that come up in study after study. We now know almost 80 different genetic variants that seem to play some role in Parkinson's disease.
My first symptoms started around 2008. Noticed that I was having cramps in my left foot when I was walking. I actually got to the point where it was so difficult to walk, I couldn't go more than a block without the cramps making me stop and rest.
I was the one who noticed on our walks that his left arm no longer had a swing to it.
It was sort of frozen as I was walking. And at that same time, noticed that I lost my sense of smell.
The first time I noticed the tremor, we were on the way back from a trip to celebrate Gary's 60th birthday, and I first saw the tremor start in his pinky of his left hand.
Tremor is abnormal, so if patients have shaking back and forth, they should see a physician, preferably a neurologist or a movement disorder physician, to get appropriately diagnosed. We look for a story of a progression of signs and symptoms. We depend on at least 2 of 3, slow and small movement, stiffness, and tremor. And in addition, there are other features that can come even before slowness, stiffness, tremor, like decreased sense of smell and REM behavior disorder, which is acting out your dreams, hitting and kicking at night while one is asleep, that are associated problems that are beginning to help us diagnose Parkinson's disease even earlier.
It was 4 years of going to different doctors before I actually was diagnosed.
When we first got the diagnosis, I think at first I was more grateful for what it wasn't, that it was something you can live with and live well.
Without treatment, the signs of Parkinson's disease progress.
As soon as I started the medication, it allowed me to go back to a normal routine, exercising, walking.
What I tell patients is that we have medications today that do a pretty good job initially. More difficulty occurs as we move from 5 to 10 years. At that time, many patients find that the medication is lasting a shorter and shorter amount of time.
It could get to the point where some people need to take meds every few hours. Luckily for me, progression has been somewhat slower, to the point where I can still take the same dose that I was taking when I was originally diagnosed. There's a big difference between when you're on medication, I mean, you've taken your dosing and the medication's working, and when you're off the medications and when your symptoms are very apparent.
Off periods refer to time when the medication is worn off or is yet to kick in, and the patient is experiencing a return of Parkinson's symptoms. When patients experience an off episode, they may not be able to get out of the chair or get out of the car. They may not be able to walk down the aisle at the grocery store, so it's very disruptive to patients' lives. I'm always looking for things like, do we see a difference in the movement? Is it slower? Does tremor come back? Those are real clues that it's the Parkinson's symptoms that are returning.
Many people have cognitive impact also. They feel like they're like in a cloud.
Patients can experience anxiety or depression when dopamine is falling or low in the brain. Some patients may just accept these off episodes as part of the progression of disease and not know to mention it to the physician and ask for help or treatment for them.
For me, it's very easy to know when I'm coming off because I can tell it in my foot. It immediately starts cramping. I can even get cramps when I'm sitting. Several times when I've been out, once at a sporting event, I knew that I was going to have difficulty getting back to my car, just walking from the stadium through the parking lot. It's a scary thing. You never know when you're going to wear off. Typically for me, it's about every 4 to 5 hours. But if you're active or if you're stressed, that can shorten the life of the dose that you've taken quite a bit, and you can wear off much quicker.
Managing off episodes is really a matter for a partnership between a patient and a physician. Patients should talk about the off episodes if they recognize them, but physicians also need to ask patients about them. I always ask patients, are your medications lasting from dose to dose? If not, what happens between doses? What about in the morning? What do you like when you first wake up? Does it take a while for your medication to kick in? And if off episodes are identified, then we talk about things like moving medications closer together, adding medications on top of existing medications, or switching to longer acting medications.
Now, there's no medication at this point in time that will slow or stop the progression of Parkinson's disease, but there is a lot of research that's being done with exercise and Parkinson's disease.
It's pretty clear that exercise helps patients stay their best even as the disease progresses. In addition, there's a lot of interest as to whether exercise can actually slow the progression of Parkinson's disease.
I was someone who did exercise on a regular basis, treadmill and weights, but I was advised by my movement disorder specialist that I may want to consider Tai Chi, because it helps a lot with the movement and balance that becomes a big problem with people as they progress with Parkinson's disease. After doing it for 6 years, I started looking for something different. So I started doing boxing 2 years ago with a great program at our local facility, Rocksteady Boxing.
Be nice to your partner on the other side of the bag. Make sure you're hitting the bag and not your partner.
Rocksteady Boxing is a group exercise program for people with Parkinson's disease.
That's a training routine that is extremely vigorous and it's fun.
People don't feel like they're going to rehab. They're going to work out.
One of the common complaints of people with Parkinson's is how they get affected by extremes in weather, whether it be too hot or too cold. For me, it's definitely the cold. My symptoms are noticeably worse in cold weather. Recently, Bobby and I were down in Florida visiting my parents. Mom is going to be 97 in a few weeks. My dad is still doing good. He's a youngster, only 92.
And, you know, banging drums and making other noises.
It's a great excuse for us to get to the warmer weather at this time of the year.
And time spent with them is beyond precious at this point.
I think the most important thing that people with Parkinson's disease should think about and realize is it's controllable. Parkinson's disease to me is just another obstacle. I also know I have a great support system, my family, that are going to help me through that challenge.
I think his attitude has been guiding all of us with how we deal with the situation.
I try to focus on today, making sure I get through every day the best I can and enjoy each day the best I can.